All right, we begin this hour with that startling study about autism and the response by Health and Human Services Secretary Robert F. Kennedy Jr. In a news conference, Kennedy said he was shocked by the estimates the rate of autism in the U.S. rose to 1 in 31 among 8-year-olds. He then waded into a bit of controversy when he dismissed existing research on potential causes. Take a listen.
This is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin. One of the things that I think that we need to move away from today is this ideology that the autism diagnosis, that the autism prevalence increases, the relentless increases, are simply artifacts of better diagnoses, better recognition, or changing diagnostic criteria.
CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, joins us again. Good morning.
Good morning.
So Kennedy called autism a preventable disease, but what does the research actually tell us?
Well, to be preventable, you would need to know what causes autism. We know it's multifactorial. Genetics are a big part of that. There probably is an environmental component and other things at play as well. But if you can't say what it is, other than genetics, I mean, we can't really control your genetics. So if we can't say what it is, it's very difficult, if not impossible, to prevent.
So he said he's going to prioritize studies that focus on environmental factors while pushing back on other things like genetics. What do you make of that?
Well, I do think we need to be addressing some of these environmental questions. So some of the things they're wanting to look at, in fact, I was here, I think it was last week, talking about how diabetes, type 2 diabetes or gestational diabetes during pregnancy might be a risk factor for autism. Some of the other things we've talked about are exposures to plastics, air pollution, and so on. So I do think that research is important, but to say that there is one toxin that is driving all of this is one, I think, highly unlikely, and I think is really misleading.
So scientific community, what are they saying about this? Because he says that he's not interested in researching the genetic causes, but the environmental ones.
Yeah.
Well, I think researchers, as long as they are given the freedom to pursue what they think is the best science, I think will be very happy to be able to do some of that research. That said, will that be the case? He said in the press conference he wants scientists not to be muzzled, to have that freedom. But we just had a leading food scientist, different area of study, leading food scientist on ultra-processed food, where you would think he would be given the freedom to do that research, and just stepped down because he felt like they were censoring his work.
What is the reaction from parents that have children with autism? Because I thought I heard at one point in his speech, they will never be employed, they will never be self-sufficient.
The language that he used.
The language that he, what are you hearing from parents?
Stigmatizing.
Yes.
Yeah, and I think it's really important to remember autism spectrum disorder, spectrum. There's a wide spectrum.
Wide range.
Right, so some people are completely functional like you and me and just might be super into math,
Right.
So I think we have to be very careful what language we use. We've heard from the Autism Society of America, Autism Speaks, other patient advocacy groups that were really disappointed in the kind of language, stigmatizing language that was used here. And also importantly, they have not been consulted in the planning for this research. And that is a basic tenet of this kind of research, is that you should be working with the patient advocates, understanding what is important to them as you plan.
It seemed like that would be one of the first steps.
It should be the first step.
All right, Dr. Celine Gounder, thank you so much. We appreciate you.